EMS question part 2. First question. A patient with cardiac tamponade with muffled heart sound. Which of the following the nurse to monitor? A. Pulse and respiratory rate. B. Paradoxical pulse of 40 in inspiration. The answer is B. Paradoxical pulse 40 in inspiration. Pulsus paradoxicus refers to the abnormal drop in systolic blood pressure during inspiration, commonly seen in cardiac and respiratory condition. Pulsus paradoxicus, also paradoxic pulse or paradoxical pulse, is an abnormal large decrease in stroke volume, systolic blood pressure, a drop more than 10 mmHg, G, and pulse wave amplitude during inspiration. What are the treatment of pyloric stenosis? 1. Rehydration. 2. Pyloromyotomy. Which medicine prescription the nurse should question? A. Lasix 40 mg oral BID. B. Codeine oral PRN. The answer is B. Codeine oral PRN. A float nurse from medicine floor came to telemetry unit. Which patient she receives? A. MI patient in heparin infusion. B. Hypertensive patient on Lasix. C. Atrial fibrational with anticoagulant drug. The answer is C. Atrial fibrational with anticoagulant drug. The causes of death in Saudi Arabia are ischemic heart disease and road accident. Diphtheria, which type of isolation? A. Droplet. B. Airborne. The answer is A. Droplet. Patient with schizophrenia seen with which of the following signs? A. Word salad. B. Associative looseness. The answer is B. Associative looseness. Associative looseness is categorized as one of the positive symptoms of schizophrenia, along with delusions, hallucinations, and disorganized thoughts. Loose associations is a psychological term to describe a lack of connection between ideas. This can manifest in speech as an individual moving quickly from one idea to an unrelated one in the same sentence, expressing a random jumble of words and phrases. As example of loose association would be, I like to dance, my feet are wet. How to prevent cleft lip and palate from occurring? A. Eat green vegetables and citrus fruit. B. Drink too much juice. The answer is A. Eat green vegetables and citrus fruit. An IQ of 45, what level of mental retardation? A. Moderate mental retardation. B. Severe mental retardation. C. Mild mental retardation. The answer is A. Moderate mental retardation. Mental retardation, the condition is further divided into 4 levels of retardation based on IQ, which include mild retardation with an IQ of between 50 to 55 and 70. Moderate mental retardation is IQ between 35 to 40 and 50 to 55. Severe mental retardation is with an IQ between 20 to 25 and 35 to 40. And profound mental retardation is IQ below 20 or 25. With an IQ is mild retardation characteristics. A. Needs assistance all the time. B. Can learn some of daily life activities but still needs help. The answer is B. Can learn some of daily life activities but still needs help. The nurse is planning for a community program to those who experience a disease and assess the recovery of rehabilitation or disabilities. Which level of prevention? A. Primary. B. Secondary. C. Tertiary. The answer is C. Tertiary. What is an example of primary level of prevention? A. How to be smoking cessation. B. Given education on HIV to high school students? The answer is B. Given education on HIV to high school students. During Hajj, the nurse is caring for non-Arabic speaker. What is the most appropriate action? A. Use Google Translation. B. Ask family members to interpret. C. Call a hospital interpreter services. The answer is C. Call a hospital interpreter services. A 5-year-old child was brought to the emergency room with fractured forearm. He had several bruises on his body but showed no signs of pain while palpating them. He seemed scared and did not answer to any questions asked. How should the nurse initiate therapeutic communication with the child? A. Start interviewing. B. Encourage him to speak. C. Explain about the fracture. D. Greet and show gentleness. And the nurse gives health. The answer is D. Greet and show gentleness. Nurse gives health. The nurse administered a prescribed intramuscular medication to a patient during a home health visit. How should the nurse dispose of the used needle and syringe? A. Recap the needle, then place the needle and syringe into a waterproof container until safe disposal can be made. B. Bend the needle back towards the barrel of the syringe before putting the needle and syringe in a metal trash container. C. Wrap the needle and syringe in disposable paper before putting the needle and syringe into the dirty section of the nurse equipment bag. D. Put the needle and syringe directly into a puncture-resistant plastic container that has a lid. The answer is D. Put the needle and syringe directly into a puncture-resistant plastic container that has a lid. The patient ate contaminated food and are diagnosed with hepatitis A. As a result of the food, which of the following is related to hepatitis A disease? A. The disease is transmitted through the blood. B. The disease transmitted through sexual contact. C. Incubation period is 3 to 5 weeks. D. Incubation period of 4 to 5 months. The answer is C. Incubation period of 3 to 5 weeks. The symptoms of hepatitis A appear between 2 to 5 weeks after contracting the virus. This is the incubation period where the virus is busy replicating in your body. When the virus has replicated enough to register as a threat, your immune system launches an attack against it. This is where the symptoms came from. Hepatitis A is common where sanitation is poor and where food and water are frequently contaminated. The virus is highly contagious and can live for months in the environment without a host. It also spread through person-to-person contact, leading to large outbreak in individuals' communities. A 16-year-old girl developed an infection over the surface of the heart after having her nose pierced to place jewelry on admission. She had developed pyrexia of 38 Celsius, a heart murmur, and petechial over the whole body. She was admitted to the hospital and treated with intravenous antibiotics. The nurse explains to the patient that she is a high risk for reinfection and provides discharge teaching and preventive measures. Which of the following most likely require prophylactic treatment? A. Pelvic examination. B. Dental care. C. Bronchoscopy. D. Urinary catheterization. The answer is B. Dental care. A 5-year-old child was admitted with nephrotic syndrome. A nurse noticed that the child has light facial puffiness with mild pitting edema on his hands and feet. There was no distended abdomen. The nurse should order for the child: A. High protein, high salt diet. B. Low protein, low fiber diet. C. Low protein, normal salt diet. D. Normal protein with low salt diet. The answer is D. Normal protein with low salt diet. A manager create a new position to patient educator work with head nurse. What organizational relationship? A. Square. B. Solid line. C. Matrix. D. Dotted line. The answer is D. Dotted line. The term dotted line refers to the use of a dotted line on an organizational chart. A solid line shows the relationship between an employee and their immediate supervisor or manager. When you add a dotted line, this is a person the employee reports to on specific projects or a secondary supervisor. The solid line points to an employee's primary boss. A dotted line indicates a secondary supervisor. There is a new community nurse assigned to work in Makkah, one of the most multicultural cities in Saudi Arabia, has to interact with multicultural population every day. What is the most important step the nurse should do before with the clients? A. Asking the client about his or her cultural background. B. Conducting an appropriate culturological assessment. C. Ensuring that the client has or her privacy. D. Looking at the client's file to take history. The answer is B. Conducting an appropriate culturological assessment. The doctor writes a DNR on a patient with end-stage cancer. The patient tells the nurse and express his feelings. He wants to be resuscitation. What is your nursing action? Explain to the patient to accept DNR. B. Ignore the patient's feeling. C. Follow the hospital policy. D. Report the doctor to commission for health specialties. The answer is C. Follow the hospital policy. A nurse is taking care of a woman who is in active labor. She is multipara at 38 weeks of gestation. Her cervix is 5 cm dilated, a negative 2 station with ruptured membranes. On the fetal heart rate tracing, the nurse observed a fetal heart rate baseline of 150 beats per minute with deceleration and fetal heart rate to as low as 100 beats per minute. Deceleration in heart rate occurs both during and between contraction. With each deceleration, the heart rate quickly returns to baseline after a few seconds. The nurse has anticipated which of the following? A. Client will probably deliver quickly. B. Client may need rapid intervention for a prolapse cord. C. Client has a normal fetal heart rate tracing for a multipara in active labor. D. Client has a fetal heart rate tracing consistent with poor uteroplacental blood flow. The answer is B. Client may need rapid intervention for a prolapse cord. A mother of 9 children, 3 of them with congenital anomalies, and 1 Down syndrome. She is a primary school graduate with low financial status. She is not using any methods of family planning, so the primary healthcare nurse has referred her for counseling. Which of the following indicates that the summarizes the important points during counseling? A. Provision of broad ideas to the client. B. Restatement for better understanding. C. Keeping silent while the client asking questions. D. Interpreting feelings and resistance of the client. The answer is B. Restatement for better understanding. What percentage of patients with ectopic pregnancy will have normal rising HCG levels? A. 10%. B. 25%. C. 50%. D. 95%. The answer is B. 25%. An old patient admitted to ICU with signs and symptoms of dyspnea, cough, expectoration, weakness, and edema. Which of the following conditions are correct related to these symptoms? A. Pericarditis. B. Hypertension. C. Obliterative. C, D, restrictive? The answer is A, pericarditis. The nurse prepares cardiac patient for the insertion of pulmonary artery catheter or Swan's-Ganz catheter. The nurse teaches the patient that the catheter will be inserted to provide information about A, stroke volume, B, venous pressure, C, cardiac output, D, left ventricular functioning. The answer is D, left ventricular functioning. And cardiac output, letter C. Which of the following condition will a nurse not administer erythromycin? A, Campylobacterius infection, B, multiple sclerosis, C, Legionnaire's disease, D, pneumonia. The answer is B, multiple sclerosis. A nurse is assessing a patient who is just arrived in the emergency department after a motor vehicular collision. The patient has a strong smell of alcohol or breath and restless and has a bluish discoloration on the abdomen by the umbilical. The patient vital signs or temperature of 37.2, the heart rate of 120 beats per minute, and blood pressure of 100/60. While other members of the team are evaluating the patients, the nurse should obtain A, a pair of elastic supplies support stocking, B, a chest tube insertion tray, C, supplies for peritoneal lavage, D, a vial of hydralazine. The answer is C, supplies for peritoneal lavage. A diagnostic peritoneal lavage, or DPL, is an invasive emergency procedure used to detect hemoperitoneum and help determine the need for laparotomy following abdominal trauma. A catheter is inserted into the peritoneal cavity, followed by aspiration of intraperitoneal contents, often after the dilution with crystalloids. It may be considered in the following situations: blunt abdominal trauma, stab wound to the abdominal penetrating the fascia, or with other concerns for intra-abdominal entry. A patient is attending a primary health clinic for regular checkup. He complains of constipation after assessment. The nurse instructed him to consume bulk forming foods. Which of the following is the best bulk forming foods? A, fresh fruit juice, B, raw meat, C, whole grains, D, milk products. The answer is C, whole grains. A nurse in the postnatal ward is assigned for a multiparous patient, has just delivered a healthy newborn. When should the nurse plan to take the patient's vital signs? A, every hour for the first 2 hours, B, every 30 minutes during the first hour, C, every 15 minutes during the first hour, D, every 5 minutes for the first 30 minutes. The answer is C, every 15 minutes during the first hour. A post-operative patient who underwent an abdominal procedure requests pain medication for the nurse and rates the pain at a level 9. There is a standing order for narcotic administration. When the nurse opened the narcotic box and performed a count, the number of pills remaining in the box is different than the number of pills recorded on the sheet. What is the most appropriate initial nursing action? A, notify the nursing supervisor. B, write the findings on the narcotic sheet. C, administer the patient's requested medication. D, identify the last nurse who used the narcotic. The answer is A, notify the nursing supervisor. A woman should get their pap smear tests each A, 6 months, B, 1 year, C, 3 years, D, 5 years. The answer is C, 3 years. A woman is diagnosed of gestational trophoblastic disease. What is the lab investigation has done to diagnose condition? A, cervical pap smear, B, serum HCG levels, C, serum estrogen level, D, Plasma thyroxine level. The answer is B. Serum HCG level. Gestational trophoblastic disease is suspected in women with a positive pregnancy test and any of the following unexpectedly high levels of beta HCG detected during pregnancy testing, except for placental site trophoblastic tumor and epithoid trophoblastic tumor, which results in low beta HCG levels. The risk factors for malignant sequelae include for gestational trophoblastic disease include a uterus large for dates, ovarian cyst larger than 6 cm, and with the serum of HCG levels greater than 100,000 MIU per ml. The community midwife has just finished the educational session with a group of women regarding maternal health and annual gynecological examination, along with mammogram and pap smear testing. What outcome is the most desired? A. Decrease disease prevention. B. Increase health living. C. Early detection and related issues. D. Strengthened marital relationship. The answer is C. Early detection of related issues. A female patient has been advised that laboratory test confirms herpes simplex virus or HSV type 2. The nurse should teach the patient that a papaniculo test or pap smear is recommended. A. Every 6 months if symptoms persist despite of the treatment. B. Every year even if symptomatic whenever symptoms recur. C. Every 3 years if other pap smear have been negative. The answer is A. Every 6 months if symptoms persist despite of the treatment. A female patient complains of abdominal discomfort. Watery stool has been leaking from the rectum. What could be a sign of which of the following? A. Fecal impaction. B. Constipation. C. Bowel incontinence. D. Diarrhea. Fecal impaction, this is known as stool impaction. The muscle of the rectum and intestines stretched and eventually weaken. This allows watery stool from farther up to the digestive tract to move around the impacted stools and leak out. Long-lasting constipation also may cause nerve damage and lead to fecal incontinence and abdominal discomfort. Encomparesis, or sometimes called fecal incontinence or soiling, is the repeated passing of stool, usually involuntarily, into clothing. Typically, it happens when impacted stools collected in the colon and rectum. The colon becomes too full and liquid stool leaks around the retained stool or staining underwear. Which of the following religion is prohibited the blood transfusion? A. Christian. B. Muslim. C. Jewish. D. Jehovah. The answer is D. Jehovah. A patient who had abdominal surgery 6 days ago has been ambulating in the halls without much difficulty. However, on 7th post-operative day, the patient complains of increased pain at incisional site and in walking bent over. What is the most likely cause? A. Intestinal inflammation. B. Primary pulmonary edema. C. Wound infection. D. Deep vein thrombosis. The answer is C. Wound infection. A 29-year-old woman had been diagnosed with a 3 cm ovarian cyst. Which of the following is the appropriate step in management? A. Cyst aspiration. B. Hormonal therapy. C. Cyst removal by laparoscopy. D. Examination after next menstruation. The answer is D. Examination after next menstruation. A 25-year-old woman has a family history of breast cancer. The nurse reviews the procedure for breast self-examination and tells her that the best time for a woman to perform a breast self-examination is A few days before her period. B. During her menstrual period. C. On the last day of menstrual flow. D. 3 to 7 days after the beginning of her period. The answer is D. 3 to 7 days after the beginning of her period. The nurse is instructing a female client how to do breast self-exam. Which of the following is the best time to perform this exam? A. After ovulation. B. After period. C. 2 weeks after period. D. 3 days before period. The answer is B. After period. At labor room, a nurse assessed the condition of the patient and gathered the following data. Cervical dilatation of 2 to 5 minutes lasting 40 to 60 seconds, increasing blood flow, shoe leg discomfort with heaviness. What is the significance of the data? A. The patient is on the first stage of labor. B. Patient is on the third stage of labor. C. Patient is on the second stage of labor. D. Patient is experiencing a prolonged labor. The answer is A. Patient is on the first stage of labor. Establishes baby hydration. An 11-month-old boy with cleft lip and palate was discharged from the hospital after surgery. The nurse provided the parents with teaching. Which of the following statement by the parents indicate appropriate understanding of the teaching instruction? A. I should avoid that my infant cry as much as possible. B. I should use a spoon to feed my child after the surgery. C. I will put my child in his abdomen after feeding. D. I will use lotion to ease my child's lip irritation. The answer is A. I should avoid that my infants cry as much as possible. What is the site for epidural anesthesia? A. From L3 to L4. B. From L1 to L2. C. From T3 to T4. D. From C1 to C2. The answer is A. From L3 to L4. The scale used by a nurse to assess the gestational age of the newborn. A. Bishop score. B. Ballard score. C. Bell-Ward score. D. Apgar score. The answer is B. Ballard score. An adult 15-year-old hospitalized to relieve anxiety. What should the nurse do? A. Increase numbers of staffing during nursing care. B. Limited numbers of staffing during nursing care. C. Allow parents to visit him a long daytime. The answer is B. Limited members of staff during nursing care. A nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client, knowing that the client is at risk for which acid-base disorder? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. The answer is B. Metabolic alkalosis. The nurse is preparing to insert a nasogastric tube into a client. The nurse places the client in which position for insertion? A. Right side. B. Low Fowlers. C. High Fowlers. D. Supine with the head flat. The answer is C. High Fowlers. A mother of 9 children, 3 of them with congenital anomalies, Down syndrome. She is a primary school graduate with low status. She is not using any methods of family planning, so the healthcare nurse was referred her for counseling. Which of the following application the counselor can help to Mrs. regarding the family planning? A. Prevention level. B. Gather model. C. Group teaching. D. Rejection of Mrs. M expression. The answer is B. Gather model. Gather counseling model. G is for greetings. A is for active listening. T is telling and reflection. H is helping. E is explaining. R is refer.